Ragini is a volleyball player. During a volleyball game, she twisted her ankle. She was able to get up and she was able to bear with support her weight. As a coach, trainer, and therapist, you advise her to stop playing since you wanted to prevent further complication and asked her to apply ice. She consulted for further treatment with a physio. As she's under treatment, a close family friend suggested her that she should start doing Tai Chi in the swimming pool and undergo some acupuncture as well for pain relief. And she said that it would improve her faster return to sport. What is your understanding of using alternative therapies to aid faster recovery? You're looking for answers to these questions? You are at the right place. Welcome to this course on physical medicine and rehabilitation in sports offered by NPTEL. We are in week 7 and we are focusing on various therapeutic modalities and alternative therapies. And today's lecture is on alternative therapies in sports rehabilitation. You are with me, Wing Commander Chandrasekhar Guru. I'm a sports medicine physician in the field and I work with Department of Sports Medicine, Armed Forces Medical College, Pune. What are the learning objectives of today's lecture? We are going to look at the various bases and the principles of various alternative therapies, how they are kind of used in sports rehabilitation. We see the rationale about the usage and discuss the evidence also in utilizing them as a multimodal approach in sports rehabilitation. We also discuss a case scenario to understand how it can be practically used in a case of injury. So, over a period of time, the rehabilitation process has kind of improved or grown leaps and bounds. The toolbox has expanded with a lot of complementary therapies in sports medicine, and the focus, which was initially focused only on the physical treatment of the injury, has now kind of I would say found its way into the mind body integration and the recovery aspect as such. And it has become more athlete centered with more of evidence based practice and using an integrated approach of multiple available complementary therapies which are already available. So, with this kind of background, an accelerated rehabilitation protocol, which is the need of the hour in commercial sports industry, the alternative therapies become an important complement to conventional rehab program. It is a non-mainstream practice which is used for standard care, and the emphasis is on whole body healing, which is an holistic nature. Even the World Health Organization suggests an holistic health, you know. So it includes physical and energetic related as well as mental modalities in these alternative therapies. It doesn't mean that they are unscientific, but then it is more of a comprehensive and holistic care. So, why do you need to use alternative therapies? So, it has definitive clinical benefit in terms of promoting the healing aspect, and it is more of a benefit to the athlete in terms of mind body interaction and improvement in terms of holistic recovery as such. And with more information which is available easily and accessible easily, even the athlete themselves comes forward with various alternative therapies, and they wanted to try this and experiment these, so that the ultimate goal is to kind of return to sport at an earlier possible stage. So, it is also found that various alternative therapies helps in reducing the pain and the inflammation. It helps in improving the recovery and enhancing the performance as such. And also the focus is towards the mental wellness as such. So, with the reduction in the stress, which is bound to be more during the phase of injury rehabilitation because of the athlete staying away from the sports. So, with such kind of benefits, I think it's important to have a integrated approach where it complements your traditional way of looking at rehabilitating an injury. So, if you ask me to categorize the alternative therapies broadly, you can categorize them as say manual therapies, mind body practices related to more of relaxation, energy based methods, and then the natural remedies which are available. So let's go. It's very difficult to actually cover entire gamut. There are so many alternative therapies available, but then I've chosen those which I have kind of experienced with, or where incorporating them has kind of helped in faster rehabilitation in athletes with whom our team has worked with. So to start with is the myofascial release, though it is a form of a manual therapy wherein it kind of targets tightened fascia and to release them to improve the biomechanical force transfer, and thereby decreasing the pain as well as the spasm which is there in that particular region. So it's basically giving either using simple the therapist use their own fingers or the bony prominence like an elbow to kind of create that friction and release the tight fascia, or you can also use instruments to kind of release the tight fascia. The tightened area is located and then a continuous sustained pressure is used to kind of release that and improve the flexibility and circulation in that region. Commonly it is used in overuse injuries, even also used post competition to reduce the soreness and chronic tightness in individuals who are involved in cyclical sports like say cycling or running, where common the same group of muscles are activated over a period of time because of the cyclical movement. So there the myofascial release has a major role to play. Another important alternative therapy which is gaining popularity globally, which is not a new therapy, it is an ancient Chinese mode of therapy used in rehabilitation, basically using solid fine needles in specific meridians and energy based meridians basically, and it is found to propose that insertion of these needles kind of release endorphins and then help in kind of reducing the spasm and the swelling. Widely accepted now and often integrated in post surgical rehabilitations. Large amount of evidence that is available in various randomized control trials. Even I could find systematic review and meta-analysis of randomized control trials wherein it is found that in sports at least it is effective in reducing the myofascial pain. It's all being used widely in kind of post surgical early rehabilitation by reducing the pain as well. So acupuncture, when it is combined with an electrical modality, is an electroacupuncture. That is also a form of acupuncture that is gaining wide popularity. Dry needling is a kind of an you can say brother of acupuncture, wherein it is more of an westernized concept of dry needling, wherein it reduces the pain in myofascial trigger points and taut bands. It uses solid monofilament needles which are very thin with a small kind of covering at the shaft, and it is inserted into the myofascial trigger points, and they promote or stimulate the free nerve endings and aid in kind of release of local chemicals to release or decrease the pain. It also considered to kind of initiate a twitch response by local spinal loop, which is considered to be a desirable effect after a dry needling, which is associated with better outcome. So there's also again good evidence in terms of dry needling aiding or complementing chronic low backache, neck and shoulder pain patients. Another alternative therapy which became so famous, especially when the ace swimmer Michael Phelps used this cupping therapy before a competition in Rio Olympics. You might have seen it in media. It's basically using a vacuum force, using a cup beneath the skin, and then it causes a small vessels over the skin to get ruptured, and they form erythema along the area where the suction is applied. So the concept is that it's again an ancient technique. It uses two different mechanisms. One is the wet cupping or the dry, and the another one is the dry cupping. Dry cupping is more of a non-invasive thing. It's just the suction that is used to create the vacuum. Whereas in wet cupping, the traditional method is used to kind of make a slit in the skin over which the cup is placed, and basically to extravasate the blood which is present locally. So it is commonly used in chronic soft tissue pain conditions. Basically, the pain gate theory is the proposed mechanism by which the pain relief is achieved. And also, a few say that it is because of the nitric oxide theory, wherein nitric oxide released because of the local phenomenon, and it increases the blood flow. So, the other interesting an alternative modality that is kind of used commonly in sports rehabilitation, not mainly in terms of physical methodology to promote healing, more of a mind body connection using aroma to kind of enhance the mental and the physical balance. It uses certain essential oils to induce sleep, relaxation, and kind of reduce the pain. Mainly used in high stressed individual, highly anxious individual, especially individuals who miss out of critical competition because of an injury. So the level of stress is very high. So in such individuals found that it kind of reduces the stress. Popular scents that are used are lavender, peppermint, or an eucalyptus scent. Can be used either clubbed with a massage as a massage oil itself, or can be used as a air diffuser itself. So as I mentioned, it is used in high stress athletes. How about alternative therapy in the role of yoga and mobility work? And we've been discussing in the previous week about the mobility aspect and mobility training. Yoga, again, being an ancient technique, it's a form of movement and the various joints in a structured and a disciplined way that causes movement at various joints and improve the mobility and also improve the strength of the activated muscles, right? So it's again doing that in the right form with the right pace and with a discipline kind of causes a mind body integration, where even the breathing phases are also linked with the movement pattern. So it promotes flexibility, balance, as well as core stability. Breathing actually enhances the focus as well as the relaxation, and it reduces the injury risk through the movement control. Because of the various movement, the range of motion improves, the motor control is also active range of motion, and the motor control in this active range also improves. So it's again widely incorporated in sports discipline as a recovery method. Also in order, it's also used as a kind of a movement drill mechanism as well. One another alternative therapy that I found has been kind of very useful in injured athlete mainly, and those who are unable to focus or where the rehab adherence is poor, is meditation and mindfulness, where you kind of help recovery mentally, so that it helps in kind of physical support and then aid in faster rehabilitation. It basically helps in lowering the stress hormone, improve the pain tolerance and the focus. It also kind of helps in learning, relearning the the various motor aspects as well, and also kind of reduces the anxiety and helps in kind of allaying the fear to kind of being able to get re-injured again. So it's a very important thing that needs to be addressed in an individual who has recently sustained an injury, because it always kind of creates a trauma and decreases the confidence level. So that helps in kind of improving the confidence and helps the individual to adhere to the rehabilitation program as well. The recommendation would be to kind of schedule specific meditation and mindfulness practices as part of the sports rehabilitation program per se, and then periodizing in a particular way will help the kind of individual to focus onto the rehab per se, but also help in kind of relaxing mentally and developing the skill of adherence and discipline. in the individual. So that may subsequently also help in better sports performance as well. Incorporation of feedback has become a sole kind of component in sports rehabilitation. It's basically the goal here in this particular type of therapy is to establish the brain body recovery by means of physiological parameters. So you have various physiological parameters in terms of EEG, EMG, heart rate variability. These are used as kind of a feedback mechanism to know what the response of the individual is, whether the individual is in a relaxed state or how the individual is adapting to the training that is being incorporated in the rehabilitation program. So that gives a real time feedback to the individual as well, and it kind of helps in further fine tuning the sports rehab program. So the individual kinds of have a better control over the movement, motor, as well as helps in stress management. You can also use it as a modality to kind of re-educate neuromuscular coordination as well. Especially useful in people with ligament injuries, post-operative patients, where there's a lot of inhibition around the muscle inhibition and receptors being damaged around the area of injury or the area of surgery which has been done. So that is the important use of biofeedback training in sports rehabilitation. Another important alternative therapy which is kind of gaining so much emphasis in sports rehab is Yog Nidra and its effect on sleep in kind of promoting recovery and kind of fastening the rehabilitation protocol. It's used as a recovery tool. It's again an ancient technique wherein Yoga Nidra causes kind of an yogic sleep where the individual is not completely asleep, but then is aware to the surrounding, but then is in the low energy state of level. Sleep as such, one cannot emphasize more about the importance of sleep, wherein during the sleep itself, all the learning aspects, all the memory consolidation with respect to the cognition, even the motor learning and kind of consolidating it also happens in this during sleep. Whatever the physical training and the effects of training that happens, the adaptation again takes place during different phases of sleep. So sleep as such is an important tool. So using Yoga Nidra kind of to promote the quality of sleep kind of really gives helps in leveraging it better for a sports rehabilitation or sports performance. The modern science is that we uses a guided kind of a protocol instructions to get into this phenomenon of Yoga Nidra, wherein the individual is aware about what's happening around the surrounding and is still in the lower level of awakened state. So the evidence is coming up more in terms of using Yoga Nidra as a modality for better sleep, improving the quality of sleep in athletes, and reducing the stress and anxiety. It can be used in sports rehabilitation as well. Aquatic therapy again is a good alternative therapy. It has multiple usage in terms of rehabilitation in various phases, I would say. It is basically using the water as a medium to promote functional recovery and therapeutic exercises. So how do we use it is because water as a medium kind of reduces the stress on the joint that needs to be loaded. So that's a good modality, gives a 3D medium, and hence it can be used in wide range of populations. Say it can be used in pediatric, it can be used in orthopedic, neurological and cardiopulmonary patients. All you need is an extra harness to hold the patient and use it safely. Post-op elderly patients, again as such there will be a lot of wear and tear and degenerative changes happening in the weight dependent joints. So in such elderly patients, post-op patients, you can kind of go in for functional kind of rehabilitation using aquatic therapy. It kind of it depends on the depth of immersion of the individual in the water, and that can vary the weight bearing aspect on the joint. So that facilitates the range of motion exercises with the water as a medium. So it gives the initial resistance also. So you can start with minor resistance training. You can use the speed of water also as a form of resistance to give resistance in the individual training in the pool. So as I said, it gives a three-dimensional activation of muscles in all three different planes and reduces the joint loading. So it can be used as an excellent cross-training cardiovascular modality as well. So you find the latest trends in terms of using an underwater treadmill, a treadmill kept inside the swimming pool, wherein the individual can sort of start doing a running activity on a treadmill with the reduced loading of the lower limb. So that's a earlier way of kind of returning the individual to most required dependent sport like running. And you can use water also to kind of improve the balance and coordination, like something like a Tai Chi, which is a slow rhythmic movement of the upper and the lower body, which can be used to, which is done normally on ground, which can also be kind of practiced inside the pool to increase the kind of challenge the individual for balance and coordination. It's more commonly used in older population to kind of improve the um, balance and reduce the incidence of falls in older individuals. So let's discuss a case scenario. We started the question with this particular lecture with a question on Ragini is a volleyball player. During the game, she twisted her ankle and was able to get up and then bear her weight. So, and as a coach or a trainer or therapist, you advise her to stop playing, and you wanted to prevent the complication, protect the injured part, and you asked her to apply ice immediately. And she started consulting a physio, but meanwhile one of her family friend advised her that she should also do swimming pool based aquatic therapy exercises and undergo some acupuncture for pain relief, so that can aid her in faster return to play. So we started the lecture by asking you if you know of any of the alternative therapy that can aid in faster recovery. So with this kind of discussion that we had in the past 15-20 minutes, I think we can analyze this question better now. The volleyball player has sustained probably a grade 2 ankle injury. The integrated multimodal approach here would be in initial phase 1, you go for a cryotherapy modality, which you have already suggested in your case. You can give an electrotherapy modality by giving an IFT or an interferential therapy for pain relief. You can do a taping immediately to kind of give that additional stability to the joint, and then kind of give that proprioceptive sensation as well. You can also kind of had an aquatic therapy modality, wherein you can, if you have a whirlpool, you can use a whirlpool for kind of creating that mechanoreceptors, and then starting the process of stimulating that proprioceptions as well. If you have access to the pool, you can start up small with kind of able to stand in the pool with the height of the water at a higher level, so that the reduction in the weight bearing is there. You can go for soft tissue alternate therapy in terms of doing an ankle joint mobilization, which can kind of reduce the swelling and then enhances and causes an early mobility. It can be passive mobility. You can also start a relaxation technique in phase 1, wherein the individual might be in an anxious state. So you can start a relaxation technique in terms of using an aromatherapy, or you can use say yoga or yoga nidra to improve the sleep. So that can be introduced in phase 1. How about phase 2? In phase 2, you go in for pain control. Pain control is mainly by using electrotherapy modalities. You can also add in an acupuncture modality to reduce the pain. You can improve the motor control. Ankle injuries are more prone for recurrence. It's better to start the balance and proprioceptive exercises earlier in the sports rehab phase. In phase 2, you can start with the balance. You can club it with a biofeedback training, wherein it gives you real-time feedback. It helps the individual to learn. You can also use an NMES kind of an electric stimulation, wherein you can give that muscle learning activation along with biofeedback training. You can start with isometric training again in an pool based training. Thus, you can use multiple modalities, both physical therapy, therapeutic exercises, physical modalities. You can use electrotherapy modalities, ultrasound therapy, and also alternative therapies to kind of achieve the goal. But then, how do you choose it? It should have some scientific rationale, right? So, it is important to have an evidence-based practice. So, you should kind of be acquainted with the emerging evidence about various alternative therapies that is coming up, and what is the kind of evidence that is presently available, so that you can incorporate in your practice. It is not purely evidence, it is also the clinical experience that you gain over a period of time when you handle various athletes in your experience. And also, a third important pillar of evidence based practice is paying heed to the athletes emotions and the needs. So that also is important. So it is a combination of all these three: the evidence, the clinical experience one has, and the patient needs. A common combination of evidence based practice will definitely help in giving a better clinical judgment, and kind of help you to take an informed decision with the athlete. So, consideration in using alternative therapies in your regular rehabilitation protocol is that safety and ethics. So, there may be good hype about certain kind of alternative therapies, but it cannot purely be driven by emotions. It has to be based on scientific rationale, and hence you have to follow that ethical aspect of it and safety aspect of it, because finally it is a patient who is, or the athlete who is at the center of the treatment modality. Assess the contraindications. So it has to be a weight balanced decision making. What should be the kind of modality that should be used for particular condition. Informed consent is important in this era of legal implications. So you have a lot of legal implications. So it is important to always take an informed consent from the athlete, and then pay heed to the athlete preferences. Certification of alternative therapies. There are so many societies or so many bodies that kind of try to make it more standardized, and then more safety oriented. So it is important to also kind of undergo certain certifications which is available for certain practices. Say for example, dry needling, you have certain bodies kind of giving certificates on various levels of dry needling. So such kind of certifications also kind of gives you the right way of doing it, the safe way of doing it, and the rationale behind doing that. So that is again important. Emphasize always on professionalism and training. So therapeutic exercise remains the mainstay, but then all these available alternative therapies, they are weapons that are available in your armory, where you can choose it as per the rehabilitation goal and the athlete need, and the time that is available for the individual to return to sports. So to summarize, it is integration of all this in clinical practice which matters. Creating a multimodal hybrid rehab program is the need of the hour, and the outcomes have to be monitored. Whatever be the kind of modality you use, it has to be documented, recorded, and it has to be monitored for progress. It's important to incorporate the athlete feedback using various patient reported outcome measures as well. And it's a team collaboration, so it's important to have your team who are certified in certain therapies, so that you can have this resources with you in your team, and not one size fits all. So it is important to curate the therapies and the resources that are available with you for a particular individual and the particular demand of these sports. So with the increasing athlete demand, it is important to also understand the availability of such alternate therapies, do a scientific rationale and understanding about these therapies on your own. Don't just go by someone's recommendation. You will have to have the basic knowledge to kind of do some literature research, and then synthesize the available evidence for that particular particular alternative therapy. And then always I keep repeating this, it's important to incorporate this in your evidence-based practice with 3 pillars, namely the patient care and needs, the evidence-based information, and your clinical judgment and experience. So though for those of you who are interested in further reading in depth, you are directed to these references. These are very good references. You can go through them. Thank you for joining me for this lecture, ladies and gentlemen. Jai Hind.